Hi guys, I'm Dr. Coulter, and today we are going to focus on medication. Now there's a lot of medications out there, so I'm going to try to simplify things for you. So first we're going to talk about the types of medication. The first type of medication is what we call prescription medications. These are medications that you can only get by the doctor prescribing them for you. And we'll give you instructions as to why we're prescribing them, how to use them, and for how long you need to use them. The second are what we call over-the-counter medications. Over-the-counter medications are things that you do not need a doctor's prescription for. You can walk into your local store, purchase it for its needed purpose, and then you can determine when it is time to stop using them. The third is what we call supplements. Now, supplements fall into a different category. You can think about these as vitamins or things that you use or take on a regular basis for prevention of some kind. And we'll go into this in detail as well. So now that you know the three different types of medication, we're going to go into why you actually use them. So we use medicines for two reasons: to treat or to prevent. Treatment is when there's a problem. I hurt my elbow, I have a sprain, I have abdominal pain, and the doctor writes a prescription to make you feel better. This is usually temporary unless you have a chronic condition such as high blood pressure or diabetes. These may be long-term medications. Prevention is what we take in order to prevent something from happening. I'm using my fiber supplement to prevent constipation. I'm taking an aspirin daily to prevent a heart attack or a stroke. So you want to think about medications and their proper uses and determine why you're actually taking them. So anytime you're taking something, you always have to think about side effects. Now, side effects are things that may be common. So that's like I'm taking Benadryl and sometimes it causes me to feel drowsy. Those are not side effects that we typically worry about because they're very common. However, there are potential side effects that could be life-threatening, and these are ones you want to be aware of. An allergic reaction, which means it might be difficult to breathe, or I'm wheezing, or I see swelling of my mouth and my lips. It also can be potential organ damage, and then sometimes these things happen because two drugs interacted that should not have been taken together. So anytime you're taking something, you want to read about the side effects and ask your doctor before starting something new. The next thing to consider is proper dosing. Now, anytime you take something, you need to know what the recommended amount is. You also need to be aware of the timing. There are some things that have to be taken on an empty stomach, or some things that work better when you take it at night. So you want to be aware of that. And you always want to read the label. You never want to take too much or too little compared to the recommended dose. So if you have any questions about the medications that you've been prescribed and are taking, you can always schedule an appointment regarding medication management. This is where you can sit down with your doctor and we discuss everything that you're taking, including those vitamins and supplements, to make sure that there's no interactions, that they're safe for you to take, and to discuss how long you should continue to take it. If you have questions, call us at Family and Aesthetics Medical Centers, 832-619-1669, and you can schedule your consultation today.